My name is Iliani. My topic Canagliflozin and Cardiovascular and Renal events in type 2 diabetes. Definition: DNT2 is shortly decided that in the long term, in the association with micro and macrovascular complications, we affect multiple organs. Canagliflozin is oral antidiabetic belongs the family or individually of the 2-sodium glucose. Contraception and canagliflozin is indicated in adults with DNT2 and low when the diet exercise and low do not actually receive glycemic control in the patient in the womb MET metformin and considering the quality because of uncontrolled or contraindication. Video.
The last one we looked at today was Canagliflozin for the treatment of type 2 diabetes. This is a completely novel drug that causes glucoseuria, causes glucose in the urine to be excreted, so that patients excrete calories basically in their urine, and this is the mechanism of action. It's unlike any prior therapy for type 2 diabetes. The biggest difference here is its effect on weight, because calories literally come out in the urine, so some of the calories that patients ingest don't even end up contributing to their weight, but come out in the urine. It causes the most weight loss of any of the drugs available for type 2 diabetes. And this is the big difference really compared with the existing treatments. It is safe in the short-term studies that allowed it to be approved by the FDA. It does not cause hypoglycemia in monotherapy. It causes about the same degree of A1C reduction as other treatments for type.
Application in nursing. Control glycemic release to hypoglycemia. Control the rate of liquid administration. Control of diuresis. No oral feeding without peristaltic mode. Valorate the mental state. Education about diet and exercise. Evaluation of pharmacological complaint. Video.
This simple drink can cure diabetes in just 5 days. Diabetes is a lifetime disease that requires dieting, exercises, and medication. While there is no cure for diabetes, you can control the sugar levels naturally. Try these remedies and effectively control your blood sugar levels. Make sure you are trying home remedies in addition to your regular diabetes treatment. Diabetes causes, types, and symptoms. If there is nothing to worry too much about. There are many ways to control diabetes naturally. This way is simply incredible numerous ingredients: bananas, apples, and kiwis. Finally,
Pros and cons. Advantages. The use of canagliflozin reduces cardiovascular complications by 40% and decreases the renal impact by 40%. The mechanism of action of canagliflozin is the visible inhibition of the transport glucose. Type 2 SGLT2 will reduce the reabsorption of the glucose at the renal level. Increase elimination in urinary the dose reducing glycemia. Increase elimination of renal glucose cause osmotic diuresis. Regarding the pharmacokinetic, canagliflozin rapidly absorbs, reaching the maximum concentration, CNAX, and 1-2 hours after the administration on the dose. Efficacy 10-12. The efficacy canagliflozin in base on 9 pyruvate fast 3 WW start. Disadvantages. In contrast to the benefit, there was an highly frequent or general infection in the men 34.9 and 10.8 the dose, and mycogenical infection in women 68.8 and 7.5 the dose arm. But there was also encouraged use canagliflozin dose the risk on the amputation of the lower limb that for the new study of cardiovascular outcome indicate. Video.
Hi guys, this is Dr. Miller, diabetesreverseformula.com. I just want to do a drug review today, talk about a newer drug that's out on the market called Invokana, also known as Canagliflozin. That's the newest drug out. It was approved by the FDA March of 13, so it's only been being used for a couple of years now. And so first I want to talk about the side effects and the mechanism of the drug. This drug, unlike other drugs, a lot of drugs bully how the liver is functioning to drop sugar. They bully the GI tract to not absorb certain carbohydrates. Some drugs are bullying the pancreas to secrete more insulin into the system. There's a lot of drugs, and that's really how medications work, is by...
Its application in Ecuador. The use of canagliflozin in Ecuador has not been reported. In February 2007, the European Medication Association (EMA) understands there has been no incorrectly of amputation study with other drugs on the same class, dapagliflozin and empagliflozin. However, the ability to dose scar and believe it also an application to this other route. More than 4 studies being in the weak canagliflozin, dapagliflozin, and empagliflozin and Spain. Dr. Neil present an analysis that indication that use for canagliflozin reduce the risk of serious cardiovascular and NABCE per 1,000 patients over 5 years, 7 the risk of hospital death for her. Failure for 1,060 renal complications. Video.
Hello, I'm Dr. Ken Land, and let's talk about treating diabetes, and specifically using a drug known as Invokana. Diabetes, obviously a very common condition, about 35-40 million people in the United States with diabetes, and we seem to be losing the battle. As the waistline increases, so does the likelihood of developing diabetes. There are about 52 million people in the United States with pre-diabetes. Current trajectory, those people will be diabetic if they don't do something. We spend about $350 billion to take care of diabetes in the United States, and we're not doing a very good job. It's estimated by the Centers for Disease Control that probably somewhere around 1 person in 9 has diabetes and 1 person in 3 has pre-diabetes. Now we have a relatively new pill. It's known as Invokana. It was the first in its class. It was originally developed by a Japanese concern, licensed to an American company, Janssen Pharmaceuticals, owned by Johnson & Johnson, approved for marketing in...
Conclusion. It can be concluded that canagliflozin is new drug that derivatives may use the additional to reduce blood sugar level, produce and discrete reduction in weight and the blood sugar pressure and cardiovascular and renal events. We added to a start therapy. video.
Tim, a dysfunctional FDA has allowed it to happen again. It seems like every week we're talking about a new blockbuster drug that's killing people by the blockbuster thousands. Invokana is no different.
Yeah, it is the caboose on the type 2 diabetes drug train that the FDA just keeps shuttling down the track. You know, when you look at the history of what the FDA has done with these type 2 diabetes drugs, you know, you got Avandia, that had heart attacks and strokes. You have Actos, bladder cancer. You have Byetta, pancreatitis and pancreatic cancer. Resolin, you remember that one, liver failure. And now, with Invokana, the latest in the type 2 catastrophe out of the FDA, there's kidney failure and a condition known as diabetic ketoacidosis, a bad condition that can take your life.
Tim, I tried.